How to treat mild altitude illness. Mild altitude sickness occurs when you travel from a lower altitude to one of about 6,300 feet, 1,920.2 meters, or higher. This condition is caused by the thinner air at the higher altitude, which makes it more difficult for you to breathe. You can relieve the symptoms of mild altitude illness by doing home care within the first 24 to 48 hours of your altitude sickness. You can also try oxygen treatment and medication. There are steps you can take to prevent altitude sickness so your next climb is more enjoyable and safe. Method 1: Doing home care. 1. Descend to a lower altitude. If you start to experience any symptoms of mild altitude sickness, such as a headache, lightheadedness, or lung pain, you should descend by at least 500 m or 1,600 feet. This will give your body time to acclimatize to the altitude and relieve your symptoms. You should avoid attempting to go to higher altitudes for 2 to 3 days, or until your symptoms have disappeared. Severe altitude sickness can be fatal, so if you notice your symptoms getting worse, make sure you descend to a much lower height. Signs of severe altitude sickness include confusion, drowsiness, convulsions, shortness of breath, even while at rest, clumsiness or difficulty walking, double vision, irrational behavior, a bubbling sound in the chest or coughing up a white or pink frothy liquid. 2. Drink plenty of water. Once you have descended to a lower altitude, you should stay hydrated by drinking lots of water. Avoid drinking alcohol, as it can dehydrate you further. You should also avoid any smoking or inhaled products, including vaping, that are not medicine, as this can make it more difficult for you to breathe. It can also worsen your symptoms. 3. Allow your body to rest. Do not do any exercise or intense physical movements, as your body needs time to recover from altitude illness. You should rest for at least 2 to 3 days, or until your symptoms subside. Do not take sleeping pills to help you rest while you have altitude illness, as they can slow your breathing further and lead to complications. Method 2: Using oxygen treatment and medication. 1. Use bottled oxygen. You can treat altitude sickness by using bottled oxygen or portable hyperbaric chambers, also known as Gaimov or Certic bags. However, bottled oxygen should not be used as a substitute for descending to a lower altitude. You will be zipped into a portable hyperbaric chamber and then the chamber will be pumped full of air. You will usually spend 1 to 2 hours in the chamber until your symptoms go away. You can carry a portable oxygen chamber with you as part of your high-altitude gear in the event of altitude illness. 2. Take anti-sickness medication. You can also take an antiemetic, a known anti-sickness medication, to help with symptoms like nausea or vomiting. You can find antiemetic medication over the counter at your local drugstore or pharmacy. If you are experiencing headaches due to altitude illness, you can also take painkillers like ibuprofen or paracetamol. Follow the dosage instructions on the label. 3. Get a prescription for altitude medication from your doctor. You can also get prescription medication for altitude illness from your doctor, as prescription medication is often stronger than over-the-counter pills. The most commonly prescribed altitude medication is acetazolamide, Diamox, which has been shown to improve the symptoms of mild altitude illness. If you have developed mild altitude illness previously, your doctor may prescribe dexamethasone or nifedipine, which can help to stabilize the blood flow pattern in your lungs. Method 3: Preventing altitude illness. 1. Allow your body to acclimatize to high altitudes. You can prevent altitude sickness by allowing your body to adapt to the change in oxygen concentration at higher altitudes over a period of time. Climb to higher levels at a slow pace so your body gets used to the altitude. Start at below 10,000 feet and walk to high altitudes, rather than drive or fly. When you climb or hike above 10,000 feet, you should increase your altitude by no more than 1,000 feet a day. Try to have a rest day scheduled for every 3,000 feet gained, or every 3 days of climbing. If you climb more than 1,000 feet a day, you should come down to sleep at a lower altitude. Follow the mantra, climb high and sleep low. 2. Stay hydrated. You should drink at least 3 to 4 quarts or 12 to 16 cups of water a day. This will ensure you are well hydrated as you climb to higher altitudes. You should also avoid consuming alcohol, tobacco, and sleeping pills when you are climbing to higher altitudes. Try to maintain a diet that consists of more than 70% carbohydrates, as this will ensure you get enough nutrients at higher altitudes. If you are at risk of developing low oxygen levels in your blood, a medical condition known as anemia, your doctor may recommend you take an iron supplement to help maintain optimal blood oxygen levels on your climb or hike. 3. Bring oxygen tanks with you as part of your travel gear. You should bring oxygen tanks with you as part of your gear if you are planning to climb or hike above 10,000 feet. You should have enough oxygen to last several days. You can buy oxygen tanks at your local outdoor store or online.